us to have a bit more confidence in where we are in this cycle in relation to the spread of the virus. Overnight, there were a total of 8 cases. 4 are overseas acquired and they are in quarantine. The other 4 are locally acquired, 3 are connected to the Berala cluster, and 1, of course, a household contact for the Croydon cluster. Those 3 for Berala includes the 2 that we flagged yesterday. So just capping that, 4 locally acquired cases overnight, including the 2 that we sort of flagged yesterday. One additional case has come to our notice this morning, and why I'm taking this opportunity to talk about it. It is important because of the movement of this individual, an 18-year-old man from Berala who has tested positive, who travelled from Berala to Orange, to Nyngan and then to Broken Hill for a camping trip, is of concern for the government. And today we are urging people in Nyngan, Orange and Broken Hill to be tested and to come forward to be tested. Clinics will be set up in due course, but this is again a reminder of what can occur. What can occur for people that are moving out of Sydney, and we've said clearly in the past, if you have any symptoms, if you are concerned, you should limit your mobility. You should limit travel to regional and rural New South Wales. Even though we are confident in the health infrastructure in the regions, it brings a greater risk. And no different to the message yesterday for regional people who are intending to come to watch the Test cricket this week. If you can avoid it, if you can change your plans, I urge you to do so, because it could be a simple infection that then goes back to the region and could cause us much more concern. So again, an individual overnight who has travelled into regional rural New South Wales, and health are on top of that. Further, I just want to talk about the cricket itself. As you would have seen yesterday, Cricket Australia and the SCG have reduced numbers to 25%. Tickets have now gone on sale, and we continue to work with the SCG in relation to hosting the event. And I've said earlier today that we will be making decisions and possibly changes right up to the first ball being bowled. We're remaining flexible, and we're looking to the advice that we receive from, of course, Dr Kerry Chant's team and Dr Kerry Chant, and that's what we will do. One thing that I just want to update the public on is in relation to the public transport. Of course, we want you to wear masks. There will be an opportunity on those buses and our public transport to, of course, have QR codes. So we ask you to check in on the QR codes. Most importantly is that in a conversation that we've just had, Minister Hazzard and myself have had with Minister Constance, we will be putting in place enough transport as if it was 50% capacity at the stadium. So we're making sure there is plenty of capacity for people to social distance on public transport. I think that is just as important. And we'll continue to work with the SCG to make whatever refinements we require to get us through getting people safely to and home from the SCG. With that, I'll ask now Dr Kerry Chant to say a few words, and then, of course, Minister Hazzard.